I've been working in mental health for over 15 years. So a typical day for me would be meeting individuals and addressing their individual needs as they come in through our walk-in services. So the Downtown Community Court provides community services through our Homeless Outreach Street Team, which is comprised of EMS, APD, and our Mental Health Authority, which is Integral Care. And we also provide intensive case management services, which provide person-centered and trauma-informed navigation with the overall goal of housing. The Downtown Community Court had an opportunity to work with the community intervention specialists as that team got started. We were able to partner in implementing best practices since we serve a similar community. Now that the CIS team is fully embedded in the community, we continue to work together by providing support services for any clients that they might refer for any additional needs. We also serve as a mailing address for some of their clients and a physical meeting location, which can often come in handy when you need to meet a person at a stationary location that has support facilities and other services available. Having a mailing address is vital to navigating out of homelessness.
So they have a mail service, which we find is a huge barrier for a lot of our clients for getting through the whole process of any kind of services, particularly housing, but also getting their IDs. We also work with DACC on the clinical diversion program. They help us when clients that we have misdemeanors that qualify. They're able to go through that court system to ensure that they have an easy way to address their misdemeanor, so it's not a barrier for them to get into housing or a job.
Navigating court process or other services can feel intimidating for someone that's not familiar with the process. So by having an advocate, it allows for a building of trust. Also, it can demonstrate that you have been engaging in services in good faith and showing progress, meaningful progress in the goals that you're personally working on.
There's a lot of really incredible and way bigger scaled programs out there where they have social workers, but they're contracted, and so they ultimately work for another nonprofit. But the fact that we are here with the transit agency really helps us work quite collaboratively with our other departments, and then even just within the public safety department. When I started at CapMetro and was trying to figure out how we were going to develop a program to address people experiencing homelessness and mental health issues on our system, and we started meeting with other transit agencies who were trying to figure out the same thing. So it's kind of morphed into this really collaborative, informal group where we just come together monthly. There's transit agencies on the East Coast, West Coast, Midwest, and we talk about resources and policies that people are coming up with and just how to tackle these really challenging issues.
It's important to have innovative and person-centered approaches. It helps promote not only trust in the community, but trust for the individuals that are engaging in these services. A person-centered approach promotes that dignity and humanity in allowing a person to navigate these complex needs, and doing so in a way that is supportive and not punitive.